What if I told you there's something men don't talk about, something powerful, mysterious, even taboo, that could revolutionize your vitality, your performance, your very sense of masculinity in just 7 days? Stay with me because this is raw truth, not rehashed hype. Before we go any further, if you want more content that pushes boundaries and delivers real insight, hit subscribe and drop a like. This story might just change everything. Imagine waking up on day one with a secret ritual, one that hints at ancient Asian wisdom, whispered through centuries, promised to transform your body's vitality, sharpen your potency, and alter your sense of energy. You're about to go on a journey through 7 days of prostate massage. Not just any massage, but methods rooted in traditions beyond the West, techniques honed by healers and seekers alike. I'm going to walk you through what happens each day, what science says, and how your body and confidence can respond. Let's begin. You lie down, calm your breath, and you begin. Day 1, you start gently, using an external perineal method, resting pressure, not invasive, but deliberate. You pause, feeling as though you're coaxing something awake. In traditional contexts, particularly in Chinese medicine, gentle massage on the perineum is thought to stimulate sexual energy and support prostate fluid regulation. Almost immediately, you may notice a subtle warmth, a slow release of tension. You remain mindful, cautious, respectful to your body. Intriguing, right? Day 2. Building on that, you may incorporate a slightly more direct approach, but still external. Gentle perineal compression, careful circles. The theory: an accumulation of prostatic fluid, sometimes called prostatic congestion, can benefit from manual release. Older studies showed that repeated sessions over weeks reduced prostate enlargement in nearly all participants. You feel a shift, pressure eases, awareness deepens. Day 3. Now you introduce an internal component, lightly stimulating via the rectum with a lubricated finger, escorting gentle pressure on the prostate's anterior wall. As per medical overviews, prostate massage is usually done by inserting a finger into the rectum to release fluid. Practice intended historically to relieve symptoms of prostatitis or benign prostatic hyperplasia, BPH. You proceed with care, knowing the risks. Any pain, bleeding, or discomfort signals to stop. Day 4. Continuing the gentle internal massage, perhaps alternating movement patterns, circular strokes, mild pressure, pause and assess. Anecdotal accounts, small studies, even some preliminary 2006 clinical trials combined massage with antibiotics to treat chronic prostatitis. Improvements seen, though not statistically significant across all groups. But you feel something: subtle clarity, pressure release, the body responding. Day 5, you have consistency now. Some sources, like Verywell Health, suggest that prostate massage might alleviate symptoms of enlarged prostate or prostatitis by releasing extraseminal fluid, improving urine flow, and possibly supporting erectile function, though mainstream medical professionals often caution that evidence is limited. Yet you find the subtle energy shift real. Day 6. You experiment with tempo and sensation, very light pressure, rhythmic breathing, integrating mindfulness. In traditional Chinese medicine, massage, including techniques like Daozhuo, which use pointing, pressing, pushing, kneading, is used as an external treatment for chronic prostatitis, aiming to relax tissues, improve energy flow, and relieve pelvic tension. Your energy feels more grounded, as if latent strength is stirring. Day 7. Here's where it gets interesting. After a week, repeated stimulation has released tension, possibly improved drainage, and raised awareness of the pelvic region. There's anecdotal belief in improved urinary flow, ejaculation ease, even erectile quality. Some older reports refer to prostate massage's historical use for urinary retention and prostatitis relief, though definitive proof is lacking. On this final day, you pause. Reflect on 7 days of attentive, respectful practice. Some men may notice increased comfort in urinating, clearer sensation during release, perhaps even more intense orgasm due to prostate stimulation. Some literature likens prostate stimulation to hitting the male G spot, potentially enhancing orgasmic intensity. But let's be honest, medical consensus remains cautious. Many professional bodies assert that there's no strong evidence of benefit, noting that massage doesn't outperform antibiotics for prostatitis and recommending pelvic floor therapy instead. Still, your subjective experience, the release of tension, the heightened awareness, the possible boost in potency, feels meaningful. Let's go deeper now. What are Asian techniques exactly? Beyond Dao Zhuo, which I mentioned, traditional Chinese medicine often integrates massage with herbal therapy, enema, acupuncture. One retrospective study of prostate cancer patients combining herbal formulas, acupuncture, and massage showed improved long-term survival compared to non-users of TCM. But note, this involved cancer patients, and outcomes may not apply to healthy users or short-term practices. What about Thai massage? Not direct prostate focus, but in health.com's overview of Thai massage, practitioners report relief of urinary tract symptoms associated with benign prostatic hyperplasia, along with improved muscle function and pain reduction. Indirect evidence that external massage may support urinary comfort. You might integrate light Thai style lower abdominal or pelvic floor massage as a complement to internal stimulation. The mainstream medical view urges caution and professional evaluation. Still, lived experience for many men seems meaningful. You finish day 7 and feel connected body, mind, vitality. The truth no one tells you? This practice isn't a magic bullet, it's a catalyst. A week of intentional, respect driven connection to the body's core. Whether you felt shifts in potency, clarity, urinary ease, or simply new awareness, that's your truth. If you've walked this path, share what changed or what surprised you. And remember, always practice gently, listen to your body, consult a healthcare provider if anything feels off. If you found this deep dive into hidden seminology fascinating and you want more content that challenges conventions and equips you with both ancient wisdom and modern insight, don't forget to like and subscribe. Your support lets me keep creating. Thanks for watching, and here's to your vitality.